Courtney, it's great to have this conversation with you today to talk about healthy hunger relief. I'm so excited to be able to get into some of the conversation that we're about to have. And this is the first time I've had an opportunity to engage with you and this type of conversation and the work we're doing together with PHA.
Pamela, I am so excited to be able to engage with you and share some of the wonderful things that are happening here in Maine, but also to learn more about what you guys are doing at your food bank as well.
Well, today we're talking about the Healthy Hunger Index, and healthy hunger is new to me. Healthy hunger relief is something that we've really not focused on for our previous 40 years. It's always been hunger relief, trying to reach all those individuals that are food insecure in our service area. But this opportunity and having this conversation and going through this work and participating in the Healthy Hunger Relief Index has been a way for me personally and then professionally in leading our organization into a new conversation that actually focuses on those ways that we can better serve our neighbors.
Pamela, like you, Good Shepherd Food Bank here in Maine is really excited to partnership with PHA's Healthy Hunger Relief so that we can be a part of a collective and collaborative group of food banks that are participating in ensuring that nutrition is a priority of the work. It is essential as we continue to do our work that we engage in this conversation, not only internally, but with our partners, and then also with the network across food banks across the country.
Courtney, that's true. And organizationally, we've been focusing on that for the last year individually. And we've talked to a few of our food bank peers. But however, this work through PHA and this conversation today, and then the tool that we've been using, the index tool and assessment and the report we've gotten, enables us to be able to go a little deeper into those policies and deeper into the work strategically and programmatically, and enabling us to find resources and partners that want to be on this journey with us. And so just by having this conversation today, Courtney, and the great work that Good Shepherd Food Bank is doing in Maine and we're doing here in Southwest Virginia, will provide many more opportunities, I'm sure, for the future. And so that's what we're looking to is the future. We must evolve. We know as Feeding Southwest Virginia and our new strategic plan that we're launching, we have to evolve. Our neighbors have evolved. Our communities are different. Their needs are different. And so therefore, we have to be different. And so to do that, we need to purposely provide the opportunity for conversations like this, but also tools that justify, not just justify, but they can actually provide the appropriate information for like healthcare partners and other partners that we're looking to work with and have worked with.
And just like you, our food bank is really vested in ensuring that we are learning and growing from other network partners that are doing this work. And PHA's Healthy Hunger Relief partnership really allows us to be able to learn more, to grow more, to hear what is happening in the network, and also to be able to think more strategically internally about how we are going to move the needle when it comes to the work that we are doing. As we know, food banking has shifted. We've gone from being an emergency food to the everyday food for hundreds of thousands of Mainers in our state. And I know Southwest Virginia, you guys have become the everyday food for, so many people. It's essential for us to continue to change the narrative. What once was emergency now is everyday food. We recognize that people who live in poverty have higher rates of chronic disease. We want to be sure that we are setting people up for success through the food. And we are so excited to be able to provide the most nutritious foods possible because it allows people to be able to really have the foundation that they need to be able to feel successful within their own communities.
When we took that the Healthy Hunger Relief Index, it was pretty telling to us. Several of our executive leadership team took it, and then we looked at the results and we went, wow, we really haven't made a great impact or we haven't focused in this area enough to make a difference in our community. So, looking at the assessment, and we all participate in capacity assessments, organizational assessments, who likes to do assessments, right? But when you conduct an assessment that confirms and affirms what you already know, what you're hearing, the conversations you've already had, and it just really is a stark reality when you see it in print, right? So it was a game changer for us. I was excited about the assessment because it was the first ever healthy food assessment we've ever done, and so we embraced that assessment and used that when we went to the table and to do our hard work for our strategic planning.
And I agree with you, Pamela. It's an amazing tool that is allowing us to be able to gauge where we are and celebrate those successes, but also to really put on the table maybe those places where we need to do better. And I love the index because there's a range that we can look at. There's not just one section that it's focused on. It's a variety of topics that we can break down individually and even take those individual questions or those individual narratives and make sure that we are building out ways that we can be better and improve. And what I love is that we have a baseline with the Healthy Hunger Relief Index being in its first year in 2021, that we are able to utilize it and expand it and grow it and do it organization wide to see where we are with all staff. I'm super excited for us to really break that open and utilize this year as a baseline, but really looking at how we can grow as an organization. It's an amazing tool. And the best part is the one-on-one consultation that we had with PHA.
And, I was so excited because it's not just the staff, our team here at Feeding Southwest Virginia, right? We know when we go into the strategic planning process or any assessment, our board is engaged. And one of the most exciting things for us after we walked through the process and we talked about how we want to strategize toward more healthy food, our board came up with Nourish Neighbors. And we know that it takes the organizational staff, our volunteers and our partners, but also a board of directors that is willing to invest and have really, truly embraced the mission of Nourish Neighbors. And so for us, that was exciting that actually was, a conversation we had, but also it was some board members on our strategic planning team who really wanted to move forward and wanted our first statement in our mission statement to be Nourish Neighbors.
I love it because like your food bank, our food bank has really committed to providing nutritious foods, and that is embedded in our mission as well. It is so important as we continue to grow and build that we continue to ensure that nutrition is a priority of this work. And PHA, the Healthy Hunger Relief Index, has really provided that opportunity. And not only that, but the collaborative of the Healthy Hunger Relief organization, food banks that are committed to this work, that we get to work together and collaborate and hear these stories and get to learn better ways of how we can improve the work that we are doing. So what's next for you, Pamela?
Well, we are begin our work July the 1st, 2022, and we begin looking at what the needs of our neighbors are. So it's going to be client-centered, which is exciting for us to be able to make that turn and that adjustment, that philosophy, and programmatically deploy opportunities to include our neighbors, as well as focus on better foods and nutritious foods through our mobile marketplace, which is a new launch for us last year. April was 1 year, and we now have 26 stops that we're doing with 2 mobile grocery stores, and we're providing more nutritious food. And the largest percentage of food that our neighbors are purchasing through that program is actually fresh produce, fruits and vegetables. And we don't want to just talk about Nourish Neighbors externally and not take care of our staff staff. So we're moving into a more well-being mindset and focus on our team here as well. I believe that you can't just say it, you have to live it.
I love it, Pamela. It makes me so excited to hear you talk, and it just brings up all the things that I'm so excited about. And one of the things that you mentioned is really, your staff and ensuring their well-being. One of the things that Good Shepherd Food Bank has committed to in our nutrition policy is providing nutrition education to our staff, making sure that they have the foundation for themselves, better understand how they can make healthy food choices on their own, empowering them, making them feel empowered. But also that helps them to understand maybe why we're making tough decisions to not distribute food that they might see as valuable. Maybe it's cereal, but if it has more than 12 grams of sugar in it, we've made that commitment and decision at Good Shepherd Food Bank to not distribute it. It has too much sugar. So when people see things like cereal come through the door and we're making a decision to not distribute it, then they now understand, they recognize, what that sugar content means, not only to themselves, but also to those that we are sharing that food with if we do choose to distribute it. We've made tough decisions. We do not distribute candy. We do not distribute soda. We do not distribute cereal with over 12 grams of sugar. We do not distribute cookies. We do not distribute things like marshmallows. We recognize that those products are foods that don't necessarily have a lot of nutritional value. So we're really excited that although we're making these tough decisions, it allows us to open up space to have more nutritious foods come through our door. And like you mentioned, Pamela, I loved that you shared that you've heard from your network that people really want fruits and vegetables. We learned that too through surveys that we've done. They want things like fruits and vegetables. They want things like lean meats and proteins and low-fat dairy, more sustainable foods versus those foods that might not necessarily be as nutritious. So it's super exciting that we're able to respond to our network. And we're also able to partner with organizations because in Maine, we have a extremely large new American population. And so we're really excited to partner with organizations who can and will best meet the needs of those that they are serving through the food. We don't necessarily understand as a white American, a variety of different cultures, maybe somebody who's Muslim and Black. So we're really working with organizations and empowering them to be able to purchase things that meet the needs of those that they are serving. We understand that we have a lot further to go, and the Healthy Hunger Relief Index is one of the tools that we are using to be able to ensure that everybody across the organization has that commitment to help food equity. Pamela, we have so much to celebrate, don't we? It's been such an engaging conversation to hear all of the work that you guys are doing in Southwest Virginia. I know you guys are going far and look forward to continuing to engage in this conversation and learn from each other as you guys embark on your journey and see how we can continue to collaborate together.
Thank you, Courtney. I've enjoyed our conversation today. Hopefully it was helpful for all those that are listening, but also certainly it's been helpful for us to be able to share.
Absolutely. Thank you, Pamela.